The AOSK is somebody that empowers all our member sisters, our member congregations. The last 2 years, the AOSK looked into ways of empowering sisters who are involved in health. And it was in that the Health Association Sisterhood of Kenya was begun, celebrating 2 years to date. This is to empower the sisters who are out there reaching to the people who come to us with ill health.
All right, it is a medical day, medical camping right here at St. Mary's Mission Hospital in Lang'ata. So sisters from sister congregations which are under the umbrella of Association of Sisterhoods of Kenya have gathered here for this camp, and we just like to know what is happening. But first, I'm joined by a sister who heads the newly formed health docket under this same Sisterhoods Association in Kenya. So I'd like her to introduce herself and tell us about that docket and today's event.
Thank you so much. My name is Sister Mary Okumu. I am a sister of Mercy, and this is a very special year for the sisters in Kenya as we celebrate our 60th anniversary since the inception of the Association of Sisterhoods of Kenya. As part of our celebrations this year, we felt that we need to set aside a day that we sisters can invite ourselves to come together and mind ourselves as far as our health is concerned. So today we have a medical camp for the sisters. We are here to make sure that we are looked after, we take care of ourselves. We are very happy because there are quite a number of partners who have offered their time and resources just to come here. We are being hosted by St. Mary's Hospital in Lang'ata, and so we are happy today. We are here, we are being screened for blood pressure, for diabetes, and for many other aspects of healthcare.
We started this journey in the month of September because the celebration will be on 19th of November. So we agreed, can we do something for sisters only this time? We have the medical camps also running around for the general population in the facilities within the country. But we said, can we set up this date specifically for the sisters only? And we began with the forums on health awareness, where we talked about cancer issues, the cancer disease, the causes, how we can prevent the predisposing factors. We had good oncologists on board who really shared the knowledge with us. Then we also had another day where we talked of mental health. We are not trying to increase years or lifespan for sisters, but we are trying to help them put a little bit of value in those years that God has given us to live. That we may not live the years in misery, in pain, in complaint, feeling agitated. We want to live those few years with equality, with the substance, being able to share life with others, generously, because we have the capacity. So in simple language, we are saying self-care for sisters, it's a day to energize them, to help them understand their own health, take care of it, and be strong to serve more and better.
Today there are several services that were organized for this particular day. There was a general consultation. We have where people are seen with the general conditions. We have a gynecologist. We know like a good number of sisters, they have several issues that they never take care of themselves. So we've had gynecologists on board to be able to review these sisters, and in case of any investigations, then they can be done further investigations and be treated early. We also have cardiology services. So we have a cardiologist on board, and all the sisters are being seen. They're having their heart checked, and in case of any problem, then corrective measures are going to be taken in good time. We have a general surgeon So any sister that is seen by the general doctors and they have any condition that could need surgical interventions, we have surgeons on board. And we all know as people age, in most cases their bones become weaker and they have other joint problems, and we also have orthopedic surgeons. For that reason, we have orthopedic surgeons on board to be able to take care of that. We also have eyes. We have eyes being checked for conditions either that are related to hypertension or diabetes. We know hypertension and diabetes are the biggest cause of blindness, so the eyes are being checked. And we have also doctors who are checking the eyes for vision and any other conditions of the eye. We have a dental surgeon on board. There are also patients that are being reviewed, and anybody that needs dental services, they are being advised appropriately. And because of the logistics involved in the camp, so patients that have dental issues, they are being referred to the main hospital for further checkup or for the procedures that need to be done in the hospital.
We realized that the sisters in the Catholic Church especially, and when you think of Kenya at large, they are holding most of the health facilities all over the country, and especially in those hardship places where nobody else may want to go. And so under the bishops of Kenya, this association of the sisterhoods wanted to celebrate the life of the sisters, because many times we are involved in charity work. We do a lot of service to the people. We are very busy treating and responding to the needs of other people that hardly we have time for ourselves.
We came here to partner with the Association of Sisterhood of Kenya and the AOSK, the Health Association of Sisterhood of Kenya, to be able to support their efforts in reaching the carer for the carer themselves. As you know, sisters now in Kenya, this association has been here for 60 years, and in that 60 years they've been giving services to others, but who takes care of the sisters themselves? So we came to partner to give that service to the sisters so that they are able to understand their risk factors. They are also able to understand how they can meet their need in prevention of breast cancer, cervical cancer, prostate cancer for the communities that they serve, so that when they go back they are also able to educate the community about the same. So we started working with the association way before this camp. We started with awareness and education. We did 4 sessions of awareness virtually, where we had about 270 sisters attend. And in this one, we were just sensitizing and creating awareness. This is what breast cancer is, or dementia, mental wellness, or gynecologic cancers and gynecologic health. With that awareness, we know we're not just reaching the one person who has been reached on that call. We know we are reaching the people they will interact with as well, to be able to educate them.
Today we've made available some of the equipment that are used for screening patients, particularly in the eye care space. A fundus camera that helps to screen patients with diabetes and other diseases so that they can be diagnosed early and treated effectively in order to prevent the onset of blindness as a result of these conditions. So in a nutshell, we are very happy to have been part of this AOSK event, and this is indeed a great step in ensuring that the carers that offer care are also taken care of. And as Novartis, we want to be part of that partnership very strongly, not just with the St. Mary's Hospital, AOSK, but also KCCB, so that we can be able to improve the health and well-being of the population, the patients that are served, in line with the Novartis mission of improving and extending people's lives.
Can we appreciate the health of sisters, in a very special way? And can we give them that chance to take care of their own health and feel good as they continue serving? Because this gives a smile to them. Yeah. Then more so, we are also telling them, as you take care of your health, remember the best medicine is living positively. Everything that comes to you, take it positively. Just to change the prism from where you view things, so that you can be able to see them, the positive side of things that happen. Yeah. Yeah, so in short, this is what we are doing today.
Within St. Mary's Hospital, Langata here today, our key engagement was first to talk about the area of renal, nephrology and kidney care. We were giving a talk in terms of how then do we prevent, how do we manage, and then how do we provide treatment in case of the disease progression.
Our focus on the clinical side has been providing high quality dialysis within each of the centers, irrespective of the distance the center is the center's location. We have been investing a lot into training the various people who are involved in kidney care, the health human capital, I would say, right from the nursing staff, nutritionists, clinical officers, MDs, physicians and nephrologists. In fact, nephrologists, we have been actually tying up with the International Society of Nephrology and sending them for training to become physicians, to become nephrologists.
The sisters were able to come as they are, to explore about their own health, to explore about what the AOSK was offering for them as a way of taking care of their health. There were many partners who came to us and partnered with us. They shared their skills, they shared their materials that were of life-giving to the sisters. We thank God for our partners, the people of goodwill who have come along to share with us and to encourage us and to celebrate with us. May God bless our partners. May God bless the sisters who came for this specific day. The member congregations is 167. It's a big number since the AOSK was begun. For St. Mary's, we said thank you for their openness, for their generosity to offer us this venue to be encouraged through the talks, the empowering talks that were shared, and through the activities that were carried on for the sisters to know their health. Our health is our wealth, and our wealth is our mission. We continue to be united for the mission of Christ.
Sisters work so much in the field, taking care of everyone else, sometimes without rest, and many times we rarely take care of our own health. And these are seen as even low-some sisters because of fatigue. Some are sick, but because they have no time even to go to the hospital, when we are diagnosing them, they are at the point of departure. So as we celebrate the 60 years of the Sisterhoods of Kenya existence in the country, we want to bring the awareness of best practices. And one of the best practices is developing and adapting a health seeking behavior, such that we want to go to be checked even when we are not feeling bad, to ensure that we are well.
Quite often as sisters, we do forget ourselves. We focus on the other that needs health care, but we also need to remind ourselves now and again, we are also in need of the same health care. So I want to urge all of us to take responsibility of our own health by availing for the many opportunities that are given to us, like this one, for example, to come forth. Sometimes we are aware we are also vulnerable, but we need to also acknowledge and accept that we also need to allow others to take care of ourselves. So the screening that is taking place here is a true sign that we have allowed ourselves to feel the way our patients feel when they come for us for healthcare, and just be at the disposal of the healthcare providers that have availed themselves to come and take care of us.
AOSK is reaching out to the sisters, to the congregation who are out there in the mission, and especially those who are in hard missions, who are met by challenging situations. For example, during the COVID, the AOSK reached out to our health facilities and we are able to equip them to meet the needs of the people. Our sisters, we value them, and we are always out to see in ways that we can empower them, we can support them, we can encourage them, and we can journey with them in their mission, which is our mission as an association. As AOSK, we continue to live united. We stand as a sign of God's presence. As we celebrate 60 years, this is our spirit, this is our love, and this is our way of life.
On 16th of September 1962, the Catholic Church saw it wise to establish an association of sisterhoods in Kenya. 60 years down the line, their role and their activities and programs has been quite clear, especially their contribution towards integral human development through their beehive of activities that seeks to uplift the dignity of the lowly, reaching out to the marginalized people who are needy and attending to the needs of time through different programs and projects. And it is for this reason that today we've gathered here for this medical camping day that is set aside to take care of the sisters, considering that they are human and susceptible to healthcare crisis. Today's event has brought together sisters that are from the congregation, that are member congregations of AOSK, to be attended to and to receive talks on how to take care of themselves and how to attend to the needy people in the healthcare sector. Remember, AOSK works and touches lives on a different level of economy. And for this, we are all called upon to support them in their different mission work and to be considerate of them. Long live AOSK. Happy 60th anniversary, Association of Sisterhoods of Kenya. Together we stand as a sign of God's presence. Gratitude to my camera person, Evans Havana. My name is Sasha Elizabeth, reporting for Capuchin TV at the St. Mary's Mission Hospital in Langata, Nairobi.